the goal of this task force is to have zero hospital acquired COVID-19 infections amongst healthcare providers and workers in general. So I'll start with introducing our team. I'm fortunate to work with a great team today. We have a very knowledgeable expert panel for you today. We have Lisa Knowlton, who's one of my counterparts. She's a trauma critical care surgeon, medical educator. She's the APD for Surgical Critical Care Fellowship Program. And I assume, let me introduce myself first, so I assume everyone knows me. Osama Nassar, one of the trauma critical care surgeons. I'm the Surgical Critical Care Program Director. We have Dana Lynn, one of our surgical from endocrine surgeons. She's the APD with us, and so they're all fantastic. And we have Peter Konoski. He's one of our infection prevention control, and he's one of the experts. And we're lucky to have him here. And Dr. Amy Chang, I don't know if she's online yet or not. She's from ID, and she will join us also the Q&A discussions later on. And we have our Carleen Mills, Carleen Mills is one of our patient care managers on K7, and we'll go over issues related to how to obtain PPEs on the floor, and what's the NT room and the hallway room, and what is the PPE officer and on the COVID landing floors. So we will go to the next slide, and you could see that the agenda for today is packed. So we're going to be very quick. There's a disclosure here that the objective of this course is not to go through guidelines in details. However, it's more of a how to do things, how to, don, doff, reuse, and if there are any rationalizations to each step, we'll go over, but feel free to ask the panel any question you have, but we'll try to remain focused on how to learn PPEs. We could do a follow-up session later on to clarify and unpack the guidelines that are, changing every now and then. So, and just one thing that I would like to mention, that after the session ends at 9:30, we'd like to have the general surgery categorical residents to remain online for another hour for verification of proficiency. We have a checklist, and we're going to divide you into groups, and we're just going to verbalize each, the donning and doffing each step. We're not trying to make this difficult. However, we just want to make sure that we're all safe and we have a safe environment. One contamination in the NT room could spread lots of healthcare providers, and we want to keep you safe, and we want to keep everyone else safe in this hospital. Hi, everyone. So now we move on to our live donning session. And again, we're going to demonstrate the CDC guidelines on how to don and doff. There's lots of ways of doing it, but this is what the hospital guidelines are. So we will, and this is kind of mirroring the video they got in HealthStream, but it's going to be interactive. I'll have Dr. Lisa Knowlton narrating there on the background, and we'll go through the steps. I might make a little, comment. I might make something, wrong, just to see what you guys' reaction is. But we'll just focus on getting through it for now, and then we'll give you an opportunity to go through for question and answers. All right. So we'll start with the first step. Dr. Knowlton, you're on.
Okay, great. So good morning, everyone. We're going to start with the donning of PPE process first. So you can imagine that you're outside of the patient's room right now, or in the ante room. The first step would be to tie back your hair if applicable. That's not applicable to Dr. Nassar, but we'll just move right along to sanitizing and washing your hands. So what you want to do is perform hand hygiene for approximately 20 to 30 seconds. You're going to apply 1 to 2 pumps of alcohol-based hand rub to the palms of your dry hands. First, you want to rub palm to palm, then rub one palm over the dorsum of the other hand, and vice versa. Next, you're going to rub palm to palm with your fingers interlaced. And then you're going to rub the backs of your fingers on one hand to the opposing palm with fingers interlocked, and vice versa. Then you want to also make sure that you get your thumbs using a rotational motion. Make sure finally to clean the underneath of your fingernails and your nail beds, and continue rubbing and they're completely dry.
To the wrist.
Next step is going to be to don your gown. So you want to unfold your gown. We're going to be using usually these yellow disposable kinds. And first you want to secure it around your neck. Then next you secure the gown around your waist. So then you want to tie it around your waist, securing it in a bow that can easily be untied. And then Dr. Nassar, if you could turn around and show us, you want the edges of the back of the gown to meet so that your clothing is covered. Okay, the next step will be to don the N95 mask. So pick up your mask and cup it in your hand. Lift your chin and place the mask over your nose and mouth. You're going to stretch the bottom strap first over your head and place it on the back of your neck. And then place the top strap on the crown of your head, ensuring that the straps are not overlapping or crossed. The next thing you want to do to create your seal is to put your dominant hand thumb on the bridge of your nose and then squeeze with index and thumb of your other hand to create a seal. This maneuver will prevent a pinching effect on the nose so that air doesn't leak around the mask. Okay, now you want to check to see if the mask is properly formed to the face. Exhale and inhale to make sure that there's no air leak and that you have a good seal. Now you're ready to move on and don either your goggles or your face shield. We're going to use a face shield, or sorry, goggles for the purposes of this simulation. If you're using a face shield, you want to start by placing the elastic strap head. Ensure that the foam top of your face shield is resting in the middle of your forehead. And then once the shield is situated, check to make sure it covers the front and side of your face. The final step is to don your gloves. So put on your gloves. Those should be outside of the patient room or the ante room. And make sure that the cuff of the gloves goes over the cuff of your gown so that no skin of your wrist is exposed. Okay, now Dr. Nassar is ready to enter the patient's room.
So now I'm ready to go to the patient room. And so this is the anteroom, as Dr. Knowlton has mentioned, or the hallway. So some, isolation rooms have anteroom, and some of them do not have anteroom. And and Carlene Mills will tell us about it more after we finish this demonstration. So go to the patient room. Okay, so now I'm in the patient room right now. Okay, so I'm still in the patient room. Okay, I'm not in the hallway or the anteroom. Okay, go ahead, Dr. Lisa Knowlton.
So very important, while you're still in the patient's room, you want to make sure that you remove your gloves and gown. So the first thing you want to do is make sure that they're not grossly soiled. And then at that point, once you start to do the removal process, you want to remove the gown by untying it around the waist first, and then hold the straps.
So here if the gloves are not soiled, you could gel on top of the gloves according to the CDC video, like that. Okay. And then once it's dry, go ahead, Dr. Knowlton.
Then you can untie the straps, hold them in your hands so that they don't dangle down and contaminate your scrubs. And then you want to lean forward, crossing your hands, reaching towards your shoulders, and rip off the gown. And while you're doing this, make sure to not let the gown touch your clothes. So you really want to try and remove the gown from inside out so that you're only touching the inside of the gown, and then you can roll it into a ball and dispose of it into the biohazard bin. At the same time, you're going to remove your gloves. So remove from the inside of the glove from one hand, and then leading to the contralateral hand, making sure not to contaminate your body with the outside of the glove. So you want to slowly dispose of both of these things together into the biohazard bin in the patient room. Next, you're going to sanitize your hands as we described above for 20 or 30 seconds. The next step while you're still in the patient room is to doff the goggles or face shield. So you want to remove the face shield by grabbing the strap at the back of your head.
Usually you say, as I said, you sing 2 birthday songs for yourself. That's about 20 seconds or 23 seconds. I know it feels like forever, but just think about something, but you gotta do it properly, and we're trying to kind of relay that. Okay.
So you remove the face shield by grabbing the strap at the back of your head. Slowly remove it by pulling it down and away from your face while you're in the sniffing position. So bend forward, eyes forward, and chin out. Make sure not to touch your bare skin, and then dispose of the mask in the biohazard bin as well. And then you're going to sanitize your hands again.
So I have not disposed it in the, because we're using that face shield for future sessions, but you should get rid of it. Okay.
So another 20 to 30 seconds. And then once Dr. Nassar completes that step, he'll be ready to turn the knob and exit the patient room with bare, clean hands.
So that's very important. So you should not be wearing anything other than the mask inside the patient room. So when you touch the doorknob, there's a lot of discussion about, lots of feedback I got from the nursing staff from everywhere, is that this doorknob should be clean at all times. You should not touch it with your dirty gloves. You could touch it with clean gloves, that's fine. But this should be clean at all times, please. And the biggest question is, why are we, exposing ourselves to the virus inside, but you're about 6 feet away from the patient, so the likelihood of that is small. Even if it's aerosolized, you got the N95 mask, and then it's a brief period, and you come out, and then you go into the anteroom or the hallway. Now I'm in the anteroom. Go ahead, Dr. Nelson.
Okay, so now that you're in the anteroom, the final step is to perform hand hygiene once more, and then you want to doff your N95 mask. So in order to do that, you want to remove your mask without touching the exterior part of the mask. So this is going to involve assuming the sniffing position once more, removing one strap at a time, starting with the bottom strap, then removing the top strap. So you grasp the straps, pull them from the back of your head, and then dispose of the mask in a biohazard bin, making sure that the mask drops in first.
Now we heard that, sorry, thank you, Lisa. We heard that they're running out of the hazard red bag. So it could be in the anteroom, you get white bag, so that's fine. But they say on it PPE trash bag bin. That's what we heard. So it's interesting. But ideally, if there's a red biohazard trash bag, that's ideal. And then you hold it from the strings like that. Make sure, obviously, you don't contaminate yourself, and you get rid of it. So you get rid of your mask in the anteroom or in the hallway if there's no anteroom. Okay. And obviously we're gonna reuse this. This is an industrial mask, not hospital mask, just FYI. Okay.
Okay, and the final step is then to once again sanitize your hands for 20 to 30 seconds. And then when you're ready, we'll do the last scenario, which will involve cleaning of the face shield as well as mask reuse.
Perfect. Can we, Dana, if Carlene is online, can we go to the slides before and have Carlene tell us a little bit about the interim, all that on the patient, please? Carlene, are you ready? She had difficulties with her laptop. Carlene Mills? Or I could. All right, so let's just go with Q&A until Carlene is online. I think she had some difficulties with getting online. Okay. So we'll open questions to the panel, and I'll have Dana Lynn and Lisa Knowlton to moderate the chat, and we'll have the questions asked on chat. Okay. Are there any
So
questions?
feel free to start submitting some questions. Okay, so one question is, what if the PPE is obviously soiled?
So if the PPE is obviously soiled, you gotta change that PPE inside. You get rid of it and go just like you're doffing, and then you, if it depends what's soiled from it. If it's just gloves, you change your gloves after change your gloves and then wash your hand and put on new gloves inside the patient room. If it's the entire PPE, you got to get rid of the PPEs, and then the gown and everything, and except the mask, and you go out to the entry room of the hallway and you don new clean PPE. You go again. Peter, do you have anything to add? Peter Kowalski,
No,
IP.
That is totally correct. We want you to change your PPE if it is soiled. Gloves can be changed in the room. If a gown or the mask or eye protection is soiled, you'll have to go through the removal procedure.
Okay, and then another question is appropriate doffing of the cloth gowns, for example, as they use at Valley, really use very similar procedure. I think for those, they just have a tie at the back of the neck. So you would undo that after you do the waist one as well. So make sure that you do it in a clean fashion.
So the principles are that you do not want to contaminate what you're wearing underneath your gown. That's the principle. And the way to do that is, you got to think about what's the best way I could get rid of that gown without contaminating my clothes or my eyes or my bare skin. So the best way to do it, from experience and how the CDC described, you got to first loosen up that middle tie. You make sure you don't tie it in like a surgeon knot, so you could easily release that, and then pulling like that. Now, the most common thing that happens, they rip that flimsy yellow gown. And if you guys saw what I did, I cheated a little bit, and I do that every time I put these yellow gowns, because I tend to do the Incredible Hulk maneuver and rip my clothes. And before I put this on around my neck, see, I rip half of it, so that doesn't happen, right? So imagine you are at a COVID-19 room, you will really lose sleep if thing. Yeah, so that's back. So that's the front. Sorry, that's the back. So before you put it on around your neck, see, there's like a little. So I just usually rip half of it, because you just want it to hang on in your neck. Half of it like this, right? So it would be easy to rip, and then you don't have to go through the ripping. You have to do this and do that, and then you're worried about your scrubs or your clothes. You have to change your scrubs, and you walk through the scrub area, and you probably contaminate 5-6 people on the way. So that's very important. Try to do it under control. With practice makes perfect. I know we don't have lots of PPEs to practice, but just the concept of it, if you're in the OR and so forth, or you're seeing a patient that's contact isolation, not for COVID, like RSA or whatsoever, try to practice these skills just in case, any one of us will be involved in COVID if there's a major surge. Questions? Sorry, Peter, anything to add, Peter? Anything you want to add,
No,
Peter?
I think you covered that.
Okay, good. Okay.
Peter, there was a question. Do we gel our gloves?
Until just recently, the C has never recommended a glove. This is kind of I think a little bit of an overdue situation. They did recommend during Ebola, but this is time since and they've ever recommended using saline gloves.
Just
saying, go ahead.
Yeah. So the CDC video clearly jelly glove, but Peter and I, we had this discussion yesterday, and he made a good point. Like, if the glove is soiled, there's nothing going to clean it, right? You got to get rid of that glove. Okay, clean. Mm-hmm. So if it's soiled, doesn't look soiled. Like if you're doing something trivial, quick physical, that you could. But if it's soiled, get So doff that, rid of that glove, dispose, clean, and don new pair of gloves. Okay, and do it, and then continue on with the doffing process. All right, is that and okay? Thank
So,
this also applies to,
Sure.
using hand sanitizer on your bare skin. It does not clean spilled skin. If your hands are dirty, you need to wash with soap and water.
Thank you.
and to that effect, one person asked, if it's dry and slightly less than that, that's fine, you know, and then with the actual physical washing with soap and water, we generally recommend 20 to 30 seconds. So it's really until, you know, if you have the proper 2 pumps of hand sanitizer, it's until your hands are completely dry from that.
Which is probably 20 seconds. If you have
There's a
two good
couple
pumps.
of comments about the door handle. So once your hands are clean, one resident asked whether they can put gloves on to touch the door handle. And then Dr. Rogers made a comment about some people using either a clean glove or a paper towel to touch the door handle, which is also acceptable. Can you guys speak to that also in light of PPE conservation?
Yeah, Peter, you want to take it first and I'll go after?
If you were using soap and water in the patient's room, yes, then opening the door with a paper towel that you use to dry your hands would be perfectly appropriate. The question of how clean is that door handle is up to your faith in your coworkers and other people's ability to keep that clean. So feel free to clean anything you see if you have any doubts that it's clean. If you want to use a glove to open it, yes, feel safer doing one glove and use that to open the door. Now, after you get out of the room, you should immediately dispose of that glove and do your hand again.
And this is Carlene. I think the other thing to remember is that when you are out, as soon as you exit the room, you're going to wash your hands anyway. So sort of another.
But the bottom line, I want to put a little, like part of me wants to put a little arrow here on the doorknob. Doorknob clean, bottom line. Because you don't follow guidelines, you contaminate the doorknob, and someone else, you know, does that, follow the guidelines, and they put their hand, they go into the anteroom or the hallway. Your entire PPE stockpile that is in the hallway is all contaminated. Catastrophe. You got to understand how that is. So for you, for the health providers, and everyone, it just
have. Then just go to the nurse's station and the charge nurse will be able to walk you through all of that. But if you find yourself on a unit that is primarily COVID, that's who you would expect to connect with. And that will be, that will play into sort of whether or not we're going to be reusing or extended using our PPE, because that will only really, I think, happen on designated COVID units, which we can talk about later.
Thank you, Carlene. So can you go back to that slide, Dr. Lin? So I want to, this is a picture I took. I took a bunch of pictures and videos. Just for those of you that do not work regularly on the inpatient floors and are confused, they walk by this first set of rooms at each entrance to the floor, which are the negative pressure room on your on your left side and on your right side. And what you see is, see that door, entry room on the right side, and there's that the other door that gets directly to the patient. Do not, if it's do not go through that brown door. See that? Because a big line. So by mistake, don't make sure you're on your phone and, oh, oops, I got into a COVID patient and I'm bare skin. Don't do that. All right. Be careful, please. Very important. Okay. Always get your radar up and, you know, and look around, because with what's going on with COVID, some COVID patients were dispersed amongst other floors. Now we're trying to centralize them to landing zone, but be cautious. Then they all look the same, right? So be cautious. Okay. So if you want to approach a PUI or a COVID patient room, with an entry room, you go through that other door, not the wooden looking door, the other one. Okay, the beige that says stop, and it goes through all these, you know, steps of donning. And once you get to that entry room, I have pictures, but I don't want to make a big file. On your left side, you have all the required PPEs, all the required PPE. So if you really needed PPE on the floor, I know I should not be saying this, you're stuck, right? You're stuck. I mean, Carlene, pretend you didn't hear this. You go to the entry room and you get, you know, PPE to do something, which is very unlikely, but this is all you, the ideal way is to approach the patient care manager or the ANS that has PPEs on her backpack, correct, Carlene? If you want, so if I wanted to get PPEs like an N95, what do I do? If I'm on the floor, I talk to a patient who comes in with appendicitis, and oh my God, he failed all the screening. I just discovered that he has like some symptoms. What do I do?
Come to the nurses station. The nurses station is where we're holding all the masks. So we'll be able to get you masks and PPE there. In fact, that brings up a good point. There are not enough isolation carts currently in the hospital. So you will not necessarily see an isolation cart in front of an isolation room. If it's non-COVID, you definitely won't. We're using those ISO carts for the most part for a non-COVID patient. So if it's a COVID patient, their PPE is going to be with the nurse's station for the most part.
Why?
Or
because
outside of the rooms in other places. Yeah,
because
including N95.
Yeah,
Yep.
Okay, that's right. And we have a shortage with PPEs. All right. So any quick questions that came up on chat that we could address before we move on to the next part of the reuse?
Yes, just one last one, because we have infection control here today. Someone was wondering how effective the HVAC adjustments are to the ICU rooms where there are COVID patients inside. They assume that the anteroom has some role in managing airflow in a patient's room that's airborne precaution. I don't know if you could speak to that.
Sure. This is Peter.
Peter, yeah.
Yeah, the way a negative pressure room works is it's a pressure differential between the room and an adjoining room. So, for example, in the room, the areas where we do have an anteroom, the anteroom is positively pressured compared with the patient's room. So air will flow from the anteroom into the patient's room. The hallway is positively pressured compared with the anteroom. So this is a very delicate air balancing situation where air will always flow from the hallway into the anteroom and from the anteroom into the patient room. So since anything that's in the air is not going to be swimming upstream, everything will stay in the patient's room.
Okay, great. Thank you.
And to that point, I just want to add one thing. The OR rooms are positive pressure. Most of them, except one OR, we have 34. So what does that mean? That's to prevent surgical site infection. When you open the door in the OR, the air from the patient room comes outside to the hallway to push that, to prevent infection getting into the room. So if you have a COVID-19 or PUI in a positive pressure room, that's not a good thing to have. That's why it's another policy. That's why Dr. Han was, saying you got to get approval from 5 people to get to the OR for a COVID patient, because we have, I think, 134. I don't want to talk about guidelines around that because I'm not fully aware of, if we're going to use the 34, they intubate, they put him in another room, because after they're intubated, closed circuit. But that's a different discussion that I don't have lots of knowledge about at this point in time, unless someone else has from the audience. All right, let's move on to the reuse video.
Okay, so moving back to imagining Dr. Nassar still being in the patient room. So if you imagine that he was gowned and gloved as per previous, and then he has his N95 mask on, as well as his face shield. Maybe we could just put the face shield and the mask back on for purposes of this demonstration. So once again, imagine that he's removed his gown and gloves as we previously described and sanitized his hands before leaving the patient room, but he keeps the face shield on as well as the mask. So at this point, he can exit to the anteroom and sanitize his hands again. Okay, and once his hands are dry, and he's going to use the same sanitizing method that we described previously, he's going to put on a clean pair of gloves. So the next step is going to be to identify a designated clean area to rest the face shield on using appropriate antibacterial wipes. So there should be a specified area that's appropriate on each ward for you to do this.
And it's the purple one because it has most of the bactericidal. That's what I got told. I don't know, Peter, do you want to comment on that really quick?
Yes, the super Santa Claus has a short dwell time, so things should only need to stay moist for 2 minutes to have complete disinfections.
Okay, Lisa.
Okay, great. So once you clean the area, then you're going to doff the face shield. So once you're ready, Dr. Nassar, you can remove the face shield as previously described in the above scenario.
Totally. But what I do usually, in addition to that, I get 3 of these sheets out, and I'm going to tell you what I do with them. 3 sheets, okay? And one of the sheets, I rip them, I put in my left hand, and I create a clean space, as Dr. Knowlton said, with 2 sheets. So that's going to be my face shield landing zone right here on these 2 sheets. One in my hand, I'm going to put it on the side right here. This is from experience. This is the most efficient way of doing this. Okay, went through the lots of it. So 2 on the ground, two resting zone here to rest that face shield, and 1 on outside, and the one that you clean is in the garbage can. All right. Now you doff the mask. Go ahead.
Exactly. So using the sniffing position, you doff the face shield as we described previously, making sure not to touch your face. And then once it's off, in order to clean the face shield, you want to wipe it with the disinfectant wipes, starting sort of on the strap, which is clean, and then the inside of the shield, which is going to be slightly more clean than the outside. So wipe the inside of the shield, and then finally the outside. And then once you're done with that process, you can leave it on a clean surface for a few minutes to dry off.
So leave it like this, okay? Up. Can you zoom in, please, Teresa? And I put it outside. See, I'm trying to put always the upside down. Make sure that the dirty part, the outside part is to the outside, and let it rest. Okay. And now I'm reusing the N95. Okay.
Okay, great. So now you're going to remove your gloves.
And this is how you remove your gloves.
That these
for the surgeons, you guys know how to remove the gloves. Obviously, like a beak. Yes. There's a beak technique, whatever, but let's just do it the easy way. That's what we do it. Just try not to touch your gloves as much as you can.
So you're removing those because they're contaminated by cleaning the face shield. Perform hand hygiene once more, and then put on clean gloves.
I'm going to do it fast forward here. Two happy birthday songs for me. All right. Okay. All right.
Okay, and then the next step is to doff your mask. So once again, you're removing your mask without touching the exterior part of the mask or your face. So remove the bottom strap and then the top strap. Pull them forward from the back of your head. And then essentially you would dispose of this mask, or if you're reusing it, you would use a paper bag. So essentially we want to have a breathable paper bag for reuse. My understanding is that these will be available to us. You can write your name on it to prevent accidental reuse, and you want to drop the mask inside with the actual outside of the mask facing downwards. If you had a procedure mask at this point, you can fold it with the outside of the mask sort of folded against itself so that you're only exposing the clean parts.
Yeah.
Do you have one of those there to demonstrate? So you sort of fold it inside out once you remove it. Correct.
Let me put it somewhere. So
Okay.
this is uncharted. Thank you, Lisa. This is uncharted territories. The guidelines are, this is out of necessity to preserve PPEs. And, I think Peter is thinking about it probably fringe because this is not the, the standard of, but again, it's been practiced by, it's on CDC website. Lots of institutions have these policies, and we're starting to have that. And the indications for reuse of surgical mask and N95 are on the guidelines, but in a nutshell, just to make it easier for you. So you could go to the anesthesiologist right now when they're intubating non-COVID asymptomatic patients with risk of aerosol generating procedure like intubation and extubation, right? They use the N95 and they use a face shield to protect the N95, and with the premise that they will use that on and off for multiple patients through the day. So they take off the shield, they wipe it, they put it aside, and then to preserve, so the shield to protect the N95. That's what or the surgical mask if it's a low risk procedure, like in clinic, like you're doing a little bit of ENT stuff, right? So that's what they do. Now that's reuse. Now extended use is a little bit confused. So if you're on a COVID landing unit, everyone is COVID, you could wear the same PPE N95 for the entire shift. Okay, it's different. Extended use. Reuse is when you take it off, you clean the mask. Obviously, this does not apply to COVID or PUI. You got to discard the PPE, as Dr. Knowlton said before. You got to discard the PPE, but there's very little indications. Like another common indication for using N95 is in aerodigestive insufflation for these respirologists who do lots of bronchoscopy, aerodigestive insufflation, EGD, colonoscopy, right? So the same thing. You wear one, you don one N95 and a mask, right? And then after each patient encounter, you take them off, you clean the shield, you put it, and then you use it just to preserve. So you have ideally one mask. Obviously, if it's soiled, if it's wet, if it's you got some coffee stains on it from inside, right? You got to get rid of it. All right, so we're open to Q&As.
Okay, someone's asking about cleaning of cappers and pappers with wipes and what recommendations we have on that.
Peter, I'll refer that to Peter.
Yeah, there's an entire procedure on the use of cappers. I don't know if we want to really get into this now here because it's fairly lengthy. But the short answer is yes, they need to be cleaned with wipes immediately after use. So we're working on a process whereby.
Peter, lost.
Hello, can you hear me all right?
We can hear you just fine, Peter.
Okay, sorry.
I can hear you.
We are working on a process for reusing the shields on the cappers that then those can be cleaned and reused. Those were originally designed for one-time use, but we can, just as with the face shield, reuse those if we clean them.
Okay, great. And then
I'd like to add to Peter about the capper is that, sorry, Lisa, is that we are saying right now that wearing an N95 with shield, face shield, or goggles are equivalent to capper. Although when you're intubating a COVID or PUI, we're still saying we use a capper. Am I correct, Peter?
Correct. The cappers are really, we're intending those to be used for people who cannot fit test for an N95. For example, just some people have the shape of their face does not allow them to be fit tested, or people with facial hair cannot be fit tested for an N95, so they would be using cappers.
okay, do we have time for one more question?
Yes,
Couple more?
what time is it now, guys?
It's
Okay,
9:18.
yeah, we have time. Yeah, we have time.
Okay, so someone's asking about the sequence if they're wearing, presumably in the OR, if they're wearing loops or a headlight, and presumably with an N95 mask. So I would assume that the loops would kind of go in the sequence of goggles and face shield.
Peter, I'm going to take this question and see if so. glasses, loops, and sunshades do not provide the same protection as goggles or face shields. Okay, I think I'll leave it to Peter. What I would do, I will wear a face shield on top at least. If this fits on top of your own glasses, probably better. Agree with that, Peter?
Correct. Glasses do not provide adequate eye protection. I would assume the same of a loop.
Totally.
Dina, are there any questions that I've missed here? Let's see.
I think it would be helpful to review the indications for reusing the PPE. There was a comment here saying we only reuse PPE on non-COVID patients, correct?
Correct.
So can we review
Yes.
those indications?
Yes. So there's two types of reuse. There's a surgical mask, which is this one. Okay, this is level 3 mask, right? Water impervious, water resistant. Okay, that's 2 straps. Comes with a face shield or without a face shield, right? So when to reuse these? You reuse them if you're in a clinic, right? And you're doing like asymptomatic. This is non-COVID, non-PUI. A little bit of nose exams for an otolaryngologist that could provide a little bit of irritation and stuff, but not aerosolization. You could be using this on top with a face shield to protect that mask. And after each patient encounter, you would wash that. You would wipe that face shield and go through the same process with that. So it's exactly the same. There are videos at the end of the presentation on the indication of reusing N95 and the face mask. I mean, they need a little bit of tweaking and edits with infection control that we made, Lisa and I, but they could still give you the proper indication. But that's one of the common indications if you're on an ambulatory care setting and want to, reuse the mask. Obviously, if you're doing regular patient encounters, as Dr. Hahn has mentioned this morning, regular patient encounter, you're going to see, trauma patients, whichever patients, you really don't need to, put a face shield on it because this is just, very low risk of that, right? But still, you got to be cognizant on how to hold it that way when you want to go so that you don't contaminate yourself and make sure you frequently wash your hands a lot. So is that clear about the surgical mask a little bit? Okay. Now, the N95 is a little bit different story. So when you're doing high-risk procedures, so aerosol-generating procedures in asymptomatic, normal, average patients, asymptomatic, someone like us having appendicitis, assuming we're asymptomatic. So those patients, if you're doing an emergent EGD, let's say you have an EGD list or a bronchoscopy list that day, you don the N95, put a face shield on, you do your bronch, and then you do the reusing, you put it in a paper bag, and then you go get a coffee, and then they call you, okay, Mr. Doctor, so there's another procedure. You put the mask on, you open that bag, you take it from the strings like that, make sure you take it from and then you don it again, right? And then you put on the face shield again, and then you go do your procedure, come back. So EGD, bronchoscopy, and if you're an anesthesiologist, these are the ones that come to my mind. Now, Peter strongly advised to be done for TB patients. We have that on but luckily we don't have that many TB patients. Correct, Peter? Do you want to add anything else?
I believe we have 2 in-house at the moment, but
okay.
Yeah, it is not common use, but for patients with TB, yes, you can reuse the N95s. The difference being that TB is not transmitted by any contact; it has to be airborne.
Yeah. Okay. Any questions? Anything is Dr. Amy Chang? Are you online?
Hey, hi, yes.
So
I am online.
anything you want to add, or pearls of wisdom from infectious disease about donning, doffing, COVID-19, PPE?
I guess I also want to add some overall reassurance that, even like we want to follow every type of precaution that we can to keep everybody as safe as possible. But there have also been circumstances where, in kind of the early COVID exposures at El Camino and other hospitals, where many people have actively been exposed to aerosols of patients and still have not contracted COVID. So I do want to provide that reassurance that this is not going to be like definite that you will get COVID from this, but we do need to take every precaution that we can to make sure everybody stays safe in the hospital and that we don't transmit this to each other or to other patients.
Thank you, Amy. Any other questions we have?
One last question. Where will the face shields be available? We could just
great
speak to that.
question. I don't know the answer. I think there was a chain there work, but I don't know if anyone else has a better answer to that. No, there are face shields available in the OR. That's how I got this one for that demonstration. You go to the anesthesia assistant room, or I think what's what it's called, and each anesthesiologist apparently gets one of these, one N95 and face shield each day. But that's where I got it. But I think it's going to be widely distributed, hopefully soon, if we're kind of having the guidelines. That's what I heard.
Okay, great. And then same for paper bags. Well, more information to follow.
More information.
Those will be on the unit. Nurses station will have them.
Okay.
Thank you, Carly.
Mm-hmm.
Just going back, just because it's the only remaining question, when we were talking about use of loops, this is a recurrent concern for some of the ENT surgeons and maxillofacial surgeons that have zoomed in. They said that their loop light combination typically prohibits use of a face shield. So any recommendations that infection control have in that regard? And I would assume they're involved in, high risk airway procedures. So.
Oh yeah.
For a patient that's been intubated, so we're talking about using these for a COVID-19 positive patient. That would be a rare circumstance that we would be doing surgery, and the patient would one of the most dangerous parts would be the intubation and extubation, which would be done in a separate area. As far as using the loop, I do not have any recommendation for that.
I have one thought, but I don't want to, I'm going to bring it online and see if we could discuss. So the loop says, for those of you guys that, don't around the OR, because we do have audience from medicine, are like glasses that have little protuberant binoculars that kind of, give you a little bit of magnification so you could see better for a surgeon. So they could protrude up to here, depending on how expensive they are and the profile and the magnification. So to put a shield sometimes is not easy. It's going to protrude. It probably prohibits performing, usability of that shield. So I'm thinking whether a capper would be something that might be used, given that it does have clearance. I don't know if that clearance is able to fit that, but I don't want to talk about something I'm not the guideline changer person, but we could raise this concern and see what solutions we have. But that's a good thing that we got out of this session, that we could, Peter and I, and kind of raise it to the appropriate PPE task force and see what options we have. I'm just thinking right now, I know if a face shield doesn't work, probably PAPR or capper might be a good resort, especially if they have lots of aerodigestive manipulation, even in an asymptomatic, non-COVID patient, because they work on the airway, so there's lots of aerodigestive aerosolization, right? Any questions?
No other questions.
I see one here saying that for the loops question, okay, we are 3D printing regular face masks currently at Stanford. Okay, wow, there you go. So we're getting So we're getting a designed face shield, custom fit face shield for them. That'd be great. That'd be awesome. Provided they cover everything. Yeah, like a little bit of a clearance from it. That will solve that.
They're not available yet, but we're working on it. I didn't want to mention it.
I just wondered,
Rusty Hoffman took it from you. Took your, yeah.
I mean, I use loops in my cases as well. And, I guess one possibility is you wear an N95, you wear your loops, and then you know how you have those regular face mask shield combos, maybe put that as a second layer on top of everything. That might be an option.
That's a good low cost option. Yeah.
Well, one of the problems with the face shields is they do have optical properties, so everything looks a little off. If you're using with a loop, I don't know.
I think I'm going to get worse.
It may affect your vision.
I think so.
Assume.
I assume because the focus is at different levels. Again, I'm not the expert in this matter. All right. Any other questions? I think we're done. Anything else, team? Carlene, Dr. Amy Chang, anyone wants to say something? Or the group?
All right. Well, it's 9:30 on the dot. So this kind of wraps up our formal educational session. If you guys don't mind, I'm going to launch another poll before the non-general surgery residents exit. General surgery residents, just a quick reminder that we're going to break out into groups and go over these steps and have you verbalize the steps so we can verify your proficiency on this. So here comes the poll. And for those non-general surgery residents, you guys can leave the meeting after this. Thank you.
Thank you. I just one last thing I forgot to introduce. So I thank Teresa, the simulation expert here. She's behind the scene, and the gentleman here from IT that been done fantastic work coming, today and yesterday to help us with troubleshooting issues. Thank you so much, everyone.